Hello, my name is Audrey Wonder. I'm recording this video for the assessment module Elementary. The student that I used for my target student was a 9-year-old student in a life skills classroom. Her name was Avery. This student is 9 years old and has been identified as having developmental delay at the age of 3. She's been receiving services ever since. At the age of 3, her parents had noticed her having developmental delays, so they took her to the pediatrician. We began early intervention at a young age and received speech and language support as well as special ed services in OT and PT, as well as academics. Her most recent evaluation was done last year as a first grade student. She was tested using the Wechsler Intelligence Test for Children, the Woodcock-Johnson test, the Comprehensive Test of Nonverbal Intelligence, the Behavior Assessment System for Children, and the Conners Rating Scale and the Adaptive Behavior Assessment System. These tests were completed by the school psychologist, and then the rating scales were completed by her teacher as well as her parents. On the first test, the WISC, the Wechsler Intelligence Test, it was used to measure Avery's overall cognitive ability. The test compares Avery's performance to a large standardized scale. The purpose of this test was to measure her individual ability in a natural setting such as school or home. In this case, it was done at school. The comprehensive nonverbal intelligence was used to measure Avery's cognitive functioning skills. This test measures her reasoning, her classification, sequential reasoning using pictures of familiar objects. This standardized test uses nonverbal symbols for the students as an administration. The Woodcock-Johnson was used to measure Avery's academic skills in reading, math, and written language. Next, the BASC was used as a parent rating scale and a teacher rating scale. This was given to both the parents and the teachers to fill out to look at areas of that Avery may be at risk, such as motion, adaptive skills, and other behavioral learning skills. The Connor scales was also used as rating scales from the teacher and the parent, which is typically used for children ages 6 to 18. This scale is particularly useful when looking for students who may have possible ADHD. The last test was the test of language development presented by this speech therapist at the school. This uses standardized with subtests that look at syntactical use, understanding, thoughts and organization, listening skills, all related to speech and language. When looking at how Avery performed on these tests, she had a full scale IQ on the WISC in the 1 percentile. As for her standard score for the WISC, her full scale IQ was a 65. Looking at her general ability index during the WISC, her percentile score was in the 4, and her standard score was 70 for the WISC was 74 for the general ability index. The next test I took a look at was the Woodcock-Johnson. Her scores were in the low and very low range for her math, reading, and written expression. When looking at the Woodcock-Johnson for the standard score, her standard score was a 67. Her percentile was 1. The next test I took a look at were her rating scales for the Conners and the BASC. On the Conners, Avery received elevations in a few areas. She was in the 77th percentile for ADHD. Her Overall, global index total was 76. A 76 is in the average to high average area. When looking at the BASC, the behavioral assessment, Avery's scores were in the average. A few of her scores did show up at the at-risk level. Avery was at risk for attention, functional communication, and executive functioning skills. Overall, these tests were able to identify some strengths and weaknesses for Avery. Some strengths would be that Avery would benefit from a structured classroom. She's an enthusiastic learner. She works well and gets along with others. She asks for help when needed. She has a nice voice and fluency skills. She has speech articulation skills within normal limits. She has great letter formation, coloring skills, grasping skills. She doesn't exhibit unexpected behaviors. However, she does show need in some other behavior areas. Areas of need would be basic reading skills, reading fluency skills, reading comprehension, math calculation skills, improved organization, coping skills, expressive language skills, receptive language skills, and visual perception skills. Other areas of need would include strategies for her attention and her needs in that area. Overall, I believe that this assessment painted a great picture of Avery and who she is as a student. Reviewing her records and her observations, I would say Avery definitely does qualify as an intellectual with an intellectual disability, and I agree with that qualification. In addition, I do see Avery needing extra supports in the areas of attention and executive functioning skills as well.